Embrace's mission is to advance maternal and child health by delivering innovative solutions to the world's most vulnerable populations. We catalyze the creation of new products with strong potential to improve health outcomes in developing countries, distribute those products directly to the people who need them most, and integrate them with health education in order to have a deeper and more lasting impact on the communities that we serve. Our primary goal is to help save the lives of low birth weight and premature infants by distributing our inexpensive, effective infant warmer in conjunction with education programs that address the root causes of hypothermia. In a few short years, we have managed to set up more than 22 programs in 11 countries on 3 continents. We've reached more than 39,000 low birth weight and premature infants. But we still have more work to do. There are millions of children suffering from hypothermia each year. Embrace is a unique organization in that we're combining innovative new technologies with proven community-based public health programs. Increased access to both technology and education is necessary to advance maternal and child health in the developing world. Our primary focus is on helping low birth weight and premature infants with our groundbreaking product and programs. But we also plan to leverage our expanding infrastructure to develop and distribute other new products and innovations that have significant potential to improve maternal and child health in developing countries. Our greatest asset is the strength of our team. The Embrace Warmer was born out of bringing different types of expertise together to solve a complex problem. That's still the DNA of our organization. We have a remarkably talented and diverse global team that comes from the fields of public health, design, engineering, and social entrepreneurship. Sometimes harmonizing all these different perspectives can take longer, but it inevitably yields much richer, more powerful results in the end. Embrace hires field representatives and external consultants to collect, aggregate, and analyze both qualitative and quantitative data from each of our sites. Robust monitoring and evaluation is a core component of our programs, and we constantly refine both the product and our program model based on our lessons learned in the field. Another unique aspect of Embrace is that we're part of a hybrid structure. In 2012, we spun off a separate social enterprise called Embrace Innovations to handle design, manufacturing, clinical testing, and sales of the warmer to governments and private entities that can afford to pay something for a low-cost hypothermia solution. This allows us to get warmers more rapidly and cost-effectively to the infants and caretakers who need them most. It's also allowed us to leverage donations and grants to our nonprofit organization and to focus on the core of our mission, which is delivering free technology and education to the poorest of the poor. In less than 2 years, we scaled up to 22 programs in 11 countries on 3 continents. We provided intensive side-by-side training to more than 4,200 mothers, family members, and healthcare workers. Most importantly, there have now been over 39,000 low birth weight and premature infants in an Embrace Warmer worldwide. Developing new technologies is only part of the battle. The real challenge lies in getting this solution to communities where there are no other options. There are many variables in each new environment where we work, everything from language barriers to political instability to cultural norms around childbirth. Above all, we have to make sure the warmers don't just sit on a shelf. This requires a long-term presence on the ground, strong partnerships with local governments and NGOs, and local staff to do the training, troubleshooting, and data collection necessary to make sure that the children who need this device are getting access to it. We're raising funds and building capacity for several specific initiatives in Uganda, India, Haiti, and Afghanistan. For example, we're seeking donors for expansion of an incredibly successful pilot project at Rabia Balki Hospital in Kabul, Afghanistan, which has led to us being invited by the local government to expand to 3 additional hospitals there. We're committed to doing this because Afghanistan has extraordinarily high rates of infant mortality. However, we still have no dedicated source of funding for our work there or in several other sites around the world. We're contacted nearly every day by doctors, midwives, and NGOs desperate to use the infant warmer for hypothermic babies in their care. We have to say no to the vast majority because we lack capacity to extend our very lean staff and operations beyond the 22 program sites and 11 countries we're committed to. We've been focused on scaling smartly and incrementally, but with additional resources, we could afford the human capital and the logistical expenses necessary to reach a significantly higher number of children around the world.